Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I would like to welcome double board certified physician, Dr. Deepa Verma. An accomplished author and blogger, she regularly appears on TV discussing current health topics. Dr. Verma aims to create healthier and happier lives for her patients through integrative medicine, with a philosophy and approach to optimal living rooted in her mantra, spreading the wealth means spreading the health. Thank you so much, Dr. Verma, for spending some time with us today.
Thanks, Monica. I'm glad to be here.
So we'd love to find out more about you and your background and where you went to school and how you got started in practicing medicine.
Well, I'm first generation Indian, so I was born in Queens, New York, and my dad had come over in the 70s, and you know, it's a land of opportunity. And then he went back a couple of years later to get married, and then they settled in Queens, my parents, and I was born there. And then we had moved to Jersey probably when I was about 5, so I spent really the majority of my life in Jersey, did all my schooling there actually. So I had gotten into a medical science program, which they choose, again, out of the county, they choose, you know, the top 20. And they had like drama, they had journalism, they had, you know, science and engineering.
Great place to go to school.
It was wonderful. It was in Monmouth County in the Freehold High School District. So I ended up, we moved to Marlborough, New Jersey, and I went to Freehold Borough High School. So I was in the medical sciences program for 3 years. After that, I went to Trenton State College, but at the last year I was about to graduate, they changed it to the College of New Jersey. So that's what it's known by. And then right after college, I went straight into medical school, and I got into Robert Wood Johnson, which also went through a name change and recently renamed as Rutgers Medical School. So I got my MD from there. Did my residency there. My ex-husband and I actually had met the first year of medical school, and so we stayed in Jersey, finished our residencies. I did family medicine. He ended up going into radiology and wanted to do interventional radiology, the surgical aspect of it. So we left Jersey because we were just tired of the snow and the cold, and we had our first son there. I have 3 boys, and we just decided it was a change. So decided for a change, and we went to Florida, Miami. He went to train at one of the top institutes in the country for vascular and interventional. Being that he trained in Miami, we were looking at West Palm Beach, that area, and then came to a place called Clearwater and just absolutely fell in love with it. So he did his second looks there, and then we settled there in 2007. I had my second son there. It was right away, and then I joined a outpatient family practice. I was the first female part-time physician they hired. I had gone there and said, listen, I'm raising a family and I really want to work. I've always worked after I had every one of my sons, and I thought, I just don't want to stay at home. So they created a position for me, and I worked for Mordant Plantbased Primary Care in Clearwater in Pinellas County, and I loved it, but it was just not something I was satisfied doing. It wasn't fulfilling how I wanted to practice medicine. There was no passion there. So I left them, and then that's a whole nother story. So
what sparked your interest in integrative medicine?
Gosh, well, being Eastern Indian, it just kind of runs through my veins. It's so innate. So growing up, I never knew it, but when my parents and my mother would, we were sick or something, she would say, well, here's a little warm milk with turmeric. Here, take some ginger, take some garlic, drink coconut water. I saw my dad doing yoga. And this is all kind of like new age stuff now here in the Western world. So I grew up with that. And I think it was just infused in me. It was something so inherent and innate. And, Indian people, we're high achievers, and it's kind of expected, after school, you can play any sport you want, you can do all your hobbies. I was a competitive tennis player and a dancer. Your parents kind of steer you into going to medical school or engineering school or, some science type thing. So my dad, was an engineer, and he always wanted to go to medical school, and he was the oldest of 5 brothers, and he actually put his younger brothers through school, and one became a doctor. And that self-sacrifice kind of really, it was almost like I wanted to do it for him, but it was just something in me. I was like, I just wanted to give. So, and it's cliche to say I just want to help people, right? But I really do, and I think it's just my nurturing personality. So, I applied. I didn't know, because it's so hard to get into an allopathic school in America, and I saw all these people around me not getting in, taking a year off, or going abroad for school, or saying they wanted to go to a different, maybe like DO school or something. So I got in, and I was thrilled, but I was a little lost because I didn't really understand how traditional medicine would work in my life. But it was always there, but I had to still complete the classic traditional MD, training, and I did it. And then I realized one day, that it wasn't for me.
So how many years into you practicing medicine the traditional way did you start to integrate all of these other modalities?
It was actually right away.
Wow.
So I had my first son in 2005 in Jersey, and then I had gotten pregnant 2 times after that, and they were both, miscarriages. And so my second one was sort of like that rainbow baby. He came right away, and that was the transition from Jersey to Florida. But because I kept working, I felt like I was just doing it because, okay, you're an MD, you just have to go. And I worked every single time from Jersey to Miami, and then when I settled in Clearwater. But I felt like I was just going through the motions. And I went back to work 3 months after every child, and I breastfed them, and I did all that stuff. And then we, grew as a family. But there was just something lacking. I would come home at the end of the day and I wasn't fulfilled. I was giving my all to raising my boys. My husband was really never home, my ex-husband now, but he was never home. He was always working and traveling. I don't know, like there's something that has to make me happier, and I don't know where to look for it. So after that, I said, okay, I'm gonna be done with traditional medicine. I gave them a heads up. And that year of transition, it was 2012, I just had all these ideas and I didn't know quite what to do. And then I just worked as a medical director at a rehab place. And then the end of 2012 came and ended up going through a divorce, which was very difficult. And then my dad passed away early 2013. It's okay. So I had all those just life-changing events, like losing a husband and losing a father. And I thought I have to do something to channel this negative energy and stress because I'm not that type of person. I like to find my Zen place and everything. So I just put the wheels into motion. I said, I'm going to open up my own practice. I didn't take any loans, anything. I knew I was going to go through a divorce. Luckily, my ex-husband said, you know what, don't take loans. Just go ahead and, pay for it, and, we'll figure it out later. So I opened up Synergistic Integrative Health in December of 2013. It didn't take off till January of 2014 when I had my open house. But I don't know, I got this space in this really beautiful place in Clearwater and right next to Meese Countryside Hospital. So it's kind of like a lot of doctors' complexes around there. And everybody wondered where I went, and I didn't really tell anybody what I was doing, so that people were looking for me. But I opened up this place, just put everything into it. I mean, everything down to like picking the little details for the furniture and just decorating. And I created like a little Zen sanctuary. I didn't want it to be a clinical, sterile place. So I don't know, I didn't do any advertising or anything.
And the rest is history, as
the rest
they
is
say.
history.
So what modalities did you initially include?
So I started off, again, and just not really knowing exactly what I wanted to do, but I was like, I want to not do insurance because insurance to me was restrictive, and I don't want people telling me what to do. And I wanted to sit with the patient for 90 minutes, and order what I wanted to order. So I reached out to a rep from one company that she was doing blood testing for, because I remember she came to see me in Morning Plant Meese, and her testing was unique. And I remember this is not stuff we could ever do in primary care because we just don't have the time. So I reached out to her, and then she started connecting me with all these others. She's like, well, you should call this, this, and this. These are the more integrative, functional medicine type. So I did that, and I just started getting everything, all my ducks in a row. I found all the great testing, because I do everything from gut health testing to adrenal to just, even the basic blood work is super duper in-depth. Like, it's not your standard Quest Lab core CBC lipids. And then I thought, okay, what else can I do? So I bought the CVAC pod, which is, I'm not sure if you know what that is. It's a hypobaric chamber, and it's on my website, but it's this cutting edge piece of technology that I was sitting in a waiting room, I think, a couple months before, and I was flipping through the Men's Journal, and it had an article on how to create a superhuman or super athlete, and they had like 4 modalities. It was like cryotherapy, and they had a CVAC pod. So I said, let me look into this. So this little company out in San Diego, it was a huge investment. It was like kind of buying a luxury car. That's how much it cost. And I thought, in the Tampa Bay area, we have all the professional teams. We have the NFL Buccaneers, we have NHL Lightning, and then we have MLB Rays. So I thought, it's a good area that people are very conscious and fit, and there are a lot of athletes here. So I got that. Do IV therapy. I do hormones. I do the PEMF mat, PEMF mat, and I just weight loss detox.
So who's your typical patient today?
Okay, so this is awesome because my patient's actually 50-50. It's male, female. The average age, I'd say, is about 30 to maybe 60, but I think my youngest is 2 years old and my oldest is 92. So I think people are just tired and sick of feeling sick and tired. So it's just everybody. It's people who are coming in and they're like, I'm just tired. I just want to lose weight. I want to feel better. you know, I don't know what's going on. Almost like that midlife crisis type thing. And then, you know, the young ones who come in, their parents bring them in because they're just tired of being on medications, you know, like, do they really have ADD? Do they need to be on Ritalin? Like, is there something else we can do? And that's when I do like food sensitivity testing. I talk to them about diet, lifestyle, take out these things, you know, from their diet and see their, you know, behavior improve. So
how were you initially introduced to A4M?
Oh, this is awesome. So when I started getting into integrative functional medicine, and after I had done the AIHM conference and got board certified, I started looking at what are the, I guess, organizations out there that can help me progress and kind of learn more. A4M was the first that I found, and I had actually attended this conference that same year I opened up my practice, and I just think like, oh my gosh, that was like 5 years ago, 4.5, 5 years ago, and here I am as like a faculty speaker. It's just phenomenal. This was where it all started, like the inspiration to do anti-aging, to learn all these different modalities. And I'm opening up a new place in Tampa. It's going to be my second location, and I'm introducing aesthetics there. So more natural kind of, you know, healing of the skin and maintaining youth, you know, for people who don't want to do the drastic, you know, cosmetic surgery and that type of stuff. So, yeah.
So what will you be speaking about tomorrow?
So tomorrow, because this theme is brain awakening, my liaison told me that maybe it would be a good idea to speak about medical cannabis. So I'm actually certified and licensed to prescribe medical cannabis, which is great because the fact that Florida now is able to do that, I mean, I felt like we were light years behind the West, you know, like Colorado and California. And I know there might be some hesitation and, you know, some skepticism there, but when I dove into it, and, you know, yeah, I was licensed and certified, but I don't even think I really knew how much there was behind the cannabis or the marijuana. And when I started researching, it's going to be the endocannabinoid system and brain awakening. It was absolutely phenomenal. And just to see why there is so much stigmatism and why it's so vilified, why marijuana and cannabis, it will blow your mind because this is something that's so ancient. But I don't want to give anything really away, so.
Well, you're not giving anything away because this will run after.
Oh, that's right, that's right.
So if you can go into more depth about that.
So, you know, when I was doing the research for the medical cannabis, it's the history of it is just mind-blowing. I mean, this is a sacred plant that we've been using in India and China for 8,000 to 10,000 years. That's as far as we can document it. It could be even older. But we actually have it listed as one of the 5 sacred plants in one of the ancient Hindu texts. It's a sacred text, the Vedas, and it's listed as one of the 5 sacred plants. And it was being used in China and India for medicinal purposes, and then there was also being used for clothing and textile. They were using hemp for oil. And then from there, it started moving east. And it got into the Middle East, and then it slowly made its way to Europe, and we had the Vikings starting to use it, and everyone was using it. They found out its medicinal properties, and it was called all these different types of things. You know, it's called like bang in, you know, India. It's called Marihuana in Chinese, and then it got to Europe, and they Linnaeus had named it cannabis. You know, we gave it the species name and the genus name, and then it got over to, you know, the New World. It came over to America, just how the explorers did. And we actually were using it for medicinal reasons, which is fascinating. And we knew it as cannabis. And come the early 1900s, what happened was during the Mexican Revolution, they were using it, and they called it marijuana. And nobody knew at that time that cannabis was the same thing as marijuana. And they had these immigrants coming over who looked different, had different customs, and couldn't speak the language. So you know, racism probably. And so they took it and they said, well, we don't know what this marijuana is. It's making these men act crazy. What are these people doing? Because they're using it for recreational use. So basically what happened, the Marijuana Tax Act was passed, and it was an effort to restrict immigration as well too. It was basically a play out of the book that happened in San Francisco decades before, where they were doing the same thing with opium to restrict Chinese immigration on the West Coast. So it's basically, you know, it was a way for them to detain and investigate, then deport them back to their country. So it was actually an immigration control. And then what happened from there is that law eventually, you know, that act became unconstitutional. And then in the 1970s, there was the Controlled Substance Act that came about, and that created the schedules of drugs. And for some reason, marijuana or cannabis ended up on Schedule 1, which are supposed to be the most dangerous drugs and have no accepted medical use. And it's listed there with, I think, LSD, heroin, and ecstasy. And it's, you know, you're talking about something that's been used for 10,000 years. And because of lack of communication and just ignorance, and that we actually had used it in America for medicinal purposes and tinctures and things like that. And it was because the Mexicans brought it over and had a different name. It's now, you know, it's outcast, you know, and it's looked at as an illegal drug. I mean, Schedule II drugs, which are supposed to be less detrimental, cocaine and meth are on there. I mean, it's almost like you would ask yourself, like, has anyone ever died of a marijuana overdose? We have alcohol-related deaths, tobacco-related deaths. We have all these drug overdoses from all those other types of drugs that I just mentioned. I mean, no one has ever, I don't know, I've never heard of anyone die of a marijuana overdose. And there's so much misinformation about that, because when the young, you know, people smoke, like when they're in college, and, you know, oh, they're losing their brain cells, they're killing their brain cells, they're becoming stoned. But you know, in my lecture and my research, I'm going to talk to you about how that's all really false information, and there's differences, you know, when how it affects the brain. And now, because the endocannabinoid system has been discovered, that really has now prompted more research into things like CBD and THC and what it can really offer. So all the neuroprotective effects, like increasing brain cognition, helping those with seizures and Alzheimer's, reversing brain aging and chronic stress, you know, treating children who have like hundreds of seizures a day where they narrow down to maybe one a day. And it's even going to be pharmaceuticalized. I mean, we already have things like Marinol and, you know, those type of Nabalone, but we're moving in the right direction. It's a little late, but
so my understanding, though, is that there still is some negative impact on the brain when it's not with CBD, but with traditional cannabis and marijuana. Is that's not the case?
No,
or?
No. Okay. You know, anything, there's a, you know, biphasic effect. You have to self-titrate it. I mean, if you do too much of anything, even if it's good, it's gonna, you know, there's what we call the Hyperemesis Syndrome. When people are just constantly smoking it, they actually develop severe nausea and vomiting. So they're saying that a lot of ERs around the country are seeing that, and then that's going to be another thing to say, well, why do we even, you know, legalize marijuana? I mean, just to make it clear, it's still federally illegal, so it's all based on the states. So whatever the state says.
So I read that you highly recommend a plant-based diet to most of your patients. So can you discuss the pros and the cons of that, and what you believe cow's milk does to one's body, et cetera?
This is a big passion of mine. This is what I really base a lot of my consults around, because, you know, food is either your safest form of medicine or it's your slowest form of poison. And even Hippocrates said, let food be thy medicine. And we, you know, our gut health is our second, you know, gut is our second brain. And it's innervated with all these neurons. And a lot of people don't know that we produce massive amounts of serotonin in the gut. So when we're treating depression and anxiety, you can't just give someone something like a Prozac and expect them to be better, or a Xanax. You have to fix their gut health, because we've destroyed our gut health because of our diet, and that's because we eat a diet that's high in inflammatory substances like meats and dairy. We overuse pharmaceuticals and antibiotics. A plant-based diet is actually created exactly for us. Our body is meant to actually consume a plant-based diet. We're made more like herbivores than carnivores. And the paleo myth is something that we need to debunk, because scientifically our bodies can't actually process meat. So let's just think about it. Carnivores can eat raw bloody meat, okay? And they're eating all parts of the meat, and that's it. They can digest it. Their guts are about 4 times their body length, so they digest that meat. Before it starts rotting, they will expel it from their body. Our guts are about 12 to 15 times our body length. So think about it. We have to cook our meat, number one, because we cannot eat raw bloody meat. If we do, we will fall sick, and we've heard many stories of undercooked raw meat where people die because they have toxic, you know, the bacteria like the E. coli, the hemorrhagic E. coli. So what happens when you cook meat is at high temperatures you change the molecular structure of it, and it creates it to be carcinogenic. And here you have meat, an animal that was killed, we don't know when. Then it sits there for God knows how long, and then we cook it. Then you have a piece of rotting meat that's literally sitting in there, and even if you have a bowel movement every day, you're not actually moving it out because our gut is so long. If you unravel it, it's actually like the length of a football field. Our enzymes, everything is made to actually consume more of a plant-based diet. And then people say, well, we have canines. What about that? We've evolved. Well, gorillas have canines. Some of the strongest animals in the animal kingdom are vegetarian. Buffalo, gorillas, elephants, horses. Look at horses. Horses are your perfect example. Beautiful, lean body, muscle. They have beautiful hair, and they are completely vegetarian. Then you have the omnivores, something like bears, for example. They can eat plants and vegetables, but they also eat raw fish. We really shouldn't be eating raw fish because of the parasites and things like that. So our enzymes, our gut health, everything is actually made. And, you know, then people say, well, what about our ancestors? Didn't they eat meat? But the Neanderthals, that Paleolithic, they actually were hunters and gatherers, and their diet, believe it or not, was actually very heavy in plants, fish, nuts, grains. Of course, they did kill animals to survive through the winter, but they used all parts of the animals. They would use the fur to keep warm, the blubber for energy, you know, the fat for energy. And the same thing goes with dairy. If we just even think about this, like, we are the only mammals in the whole animal kingdom who continue to drink milk after we're done drinking from the mother. No other mammal will need milk. And the weirdest part of that is that we consume another species' milk and we think it's absolutely normal. Like, we're done drinking formula or breast milk. Breast milk is perfect. Every animal makes perfect milk for their child and it has a perfect amount of immunoglobulins, protein, whatever the body needs. And that takes me to a whole nother thing, because we overdo protein and calcium. And breast milk actually has such a little amount of protein in there. But all of a sudden we're done with that and then we switch to cow's milk. And then we wonder why lactose intolerance is so prevalent, because cows are completely different creatures. We can tolerate goat's milk and sheep milk a little better because they're more similar in size to us. But dairy is dairy. It's very inflammatory. And that's why pediatricians even tell the parents when children are sick, hold the dairy because it creates more mucus. So right there, that's kind of saying, well, it's inflammatory. So we can't digest it. We don't need that much calcium. We're a country that has some of the highest calcium intake in the world, probably the top 3, but we also have the highest rates of osteoporosis. And that's why we don't see those milk ads anymore. And also, a cow shouldn't perpetually be producing milk. They should produce milk only when they give birth to their calves. So we've created this artificial stimulation of cows to just constantly, and we're pumping them with hormones and antibiotics. And, you know, unfortunately, it's the regulation with the food industry, and we are a bit different than Europe. They are very strict, so everything is more regulated there.
Do you find that your patients are compliant, especially if they hear that explanation, which, by the way, I've lost my appetite for.
Sorry, I didn't mean that.
So I don't know that I will touch a piece of steak again. Yeah. But it all makes sense.
Yeah.
It seems like it's really common sense. So
yeah, and I tell them, I said, I don't expect you to walk out of here being 100% plant-based. And I say plant-based because there's different nuances. To say you're vegan, you have to completely not have anything, like even honey. So I call myself plant-based because if I eat something that has some honey or some eggs in it, it's okay, but I don't actively like cook eggs. But I tell them, if you can do an 80-20 rule or 75-25, we're only human. Do something that's going to fit your lifestyle. But I send them a lot of information, scientifically backed evidence. I send them emails, tell them to watch these videos, and it just opens their eyes and they can make the decision from there. And because I blog a lot and I do my local news, everything I say has to be backed up by scientific evidence. It can't be like voodoo stuff, because when I blog, it has to be cited. And I'm talking about citing it from the journals of medicine,
right.
You know, not from like Vogue magazine
right.
or Glamour.
Right.
So,
what about your boys?
My boys, so when they're with me, I have 50-50 custody. They're completely plant-based and they love it. They, you know, it's like I tell them not to drink soda. Let's find an alternative for that. I get the Beyond Meat burgers, you know, because my oldest one tends to be a little, I don't know, he has this craving for meat. It's a little strange, but he knows, like, when we do that kind of thing, they're amazing. They're super intelligent and they're very athletic. And, you know, I've told them, listen, when you're at your dad's place, you know, make your decision and, you know, tell them what your thing is.
He doesn't share your same philosophy for...
Not really. And that's the problem. I think a lot of traditional MDs were not really
right.
taught nutrition. Like, at all in the 4 years of med school. Maybe an hour out of that 4 years.
Hopefully, a few years down the road, things will change.
I think so.
So, as an integrative and functional medicine practitioner, where do you see the future of this field going? I
think this is, you know, it's kind of new wave medicine, new age medicine here in the Western world, but keep in mind this is something, the basis of this is really Ayurvedic medicine. Ayurveda is a science of life, it's a knowledge of life. And again, we've been doing these things in India for over 10,000 years. And even if we look at China too, acupuncture, this is age-old medicine. And because we're in the new world, the Western world, if you think about our medical schools, they were only developed in the early 1900s. And you know, we've become so progressive now. And from what I'm seeing, I think this is, people are wanting to be preventative and proactive. This is going to be the new wave of the future in the Western world. And people are embracing these. I mean, the amount of people into yoga, trying to follow a plant-based diet, these are not fads. They're not fads. People are healing themselves, people with autoimmune diseases. We live in a toxic world now. And the whole issue with gluten, for example, should I be gluten-free or should I not? Here's the thing of it. We are mass producing everything. Our population's increasing. We have to produce all these things to feed everybody, right? So we're using pesticides, we're using toxic things to bring up our crops and our animals, and we're consuming it. And things we put on the body, I tell my patients, it's not just what you eat. These are things like shampoos and lotions and hand sanitizers, for example. That's one of the #1 causes of hormonal disruption and infertility. And we douse our kids with it because we're afraid of germs. Let our kids get dirty. Let them get those minerals and things from the soil. We've become so phobic of everything. So people want to be preventative and proactive. What we're doing is we're doing sick care right now. We're not doing health care. We're reactive. We're waiting for someone to fall sick. And the standard American diseases are obesity, diabetes, heart disease. We're one of the most obese nations in the country. I think people are waking up and they're saying, what can I do so I don't get to that point? Because I don't want to be like my mother or father or grandparents. What can I do so I'm not going to become diabetic? And here's the other thing. It's not about genetics. People are like very quick to blame, like, oh, I'm going to be like that when I get older, you know, because my dad was diabetic, my mom had a heart attack or whatever. Genetics only actually accounts for 20 to 25% of what happens to us. It's our lifestyle. It's epigenetics. It's the gene modification. Our lifestyle, what we eat, how we exercise, or if we don't exercise, how we sleep, all those things affect everything on a cellular level. The telomeres, everything, how we age. You know, I just did a little news segment on caloric restriction. They're actually doing studies, and we have to translate it to the human level, but you know, consuming less calories puts less stress on the body, and we don't have to use that energy to break down food, but we can use that energy to preserve the cellular aging. And so people who actually consume less calories, which you can absolutely get with the plant-based diet, they actually will remain more youthful. They have better longevity and a better quality of life. We are living longer now, but if the quality of life is not there. You know, one of the #1 causes of death in America in the elderly is polypharmacy. So how can we live to 90 but still be vibrant and youthful? It's not about like, oh, I'm 70, arthritis is normal. You can be 70, you should never have arthritis. You should feel like you did when you were 40. And I have a few patients. I had one female patient, she's 72, and she emailed me last year, and it was the most fascinating email. She goes, I don't even know how old I am. I just turned 72 and I feel like I'm 32. And
how long has she been your patient?
She started actually right when I opened up the practice. Okay. And so I haven't seen her since last year, but that email, I just was like, oh my gosh, like, it was a very long email, and the first line was, Dr. Verma, I just turned 72 and I don't even know what age I am. I still feel like I'm 32.
What modifications did you make in her life?
So I did the in-depth lab work, and then I went through everything and talked to her about her deficiencies and just told her you need to remain active, try to eat as clean as you can, and take the supplements that you need. I think, you know, again, we just try to take everything we want, and we just can't go out to the store, buy things off of Amazon and eBay and think they're okay for us. There has to be physician regulated and pharmaceutical grade. I'm very big on that because there could be toxic fillers, preservatives, just terrible ingredients and things that we buy in the vitamin store or off of the internet. We don't know because there's no FDA regulation like there is with pharmaceuticals. So it's like I can make something in my garage, for example, and just sell it, right? Nobody knows. But I do a lot of blood work, and when people are taking their vitamins and their levels come back, you know, deficient, they're shocked. They're like, well, I've been taking this vitamin for 10 years. How can I have low levels? I'm like, there you go, because you're probably taking the wrong thing, or you're taking a low quality thing.
So how long of a period of time do you see a shift happen where the blood work is now regulating and they're starting to feel better?
Mm-hmm. I give it always 6 months, but I've had patients come back to me in 3 months because those are the ones that made a little more drastic of a change. Like they quit their coffee right away. They're not acidic anymore, and they've switched to a more plant-based diet, and they started exercising, and so they're sleeping better. You know, they're feeling better. Their depression and anxiety, they're not relying on their Xanax anymore. 3 to 6 months. 6 months is usually a good time. I'll say let's repeat blood work. But if it's something more like hormones and thyroid, I'll tend to see a change a little bit before because that's a little more volatile. You know, it really gets influenced by behavioral modification.
So you're opening up your second location soon. Where do you see yourself in the future of integrative medicine in terms of you helping to promote it and get the word out there? And I know you do the news locally in Clearwater, but how else do you see yourself within the growth of integrative medicine?
I see myself at the forefront because I love putting myself out there, and I hate to say social media, but that's what it is. I love spreading the wealth of health, and I want to educate one person at a time because that makes one more difference, right? But I want to educate on a mass level to millions of people. And whether it's having my own talk show or I always used to joke like I want to be the next Dr. Oz, just like a female version. But I'm very ambitious and very driven by success. But for me, at the end of the day, just to help that one person and see them get better, I mean, that to me is everything. But I want to do it on a widespread global level. And like doing something like this here at A4M is huge. Like I'm so thankful for this opportunity. But I really want to be out there, whether again it's like having my own podcast or having like my own TV show, because to put this message out, I think you just affect so many people. And I just want to help people on that way and be there to guide and supervise and be a counselor. on a mental and physical level. It's mind, body, spirit. You know, your mental is not different from your physical. They're connected. You know, when you're depressed, that, you know, changes your gut health. It causes inflammation, and vice versa. You know, when people have a heart attack, that influences the stress levels. People die of stress. You know, it's your adrenals, it's your thyroid, it's your hormones. So people have to understand that, and I don't think we do, because we don't teach people that in traditional medicine. We don't have the time to. A 15-minute visit doesn't cut it.
I think that's a perfect place to end it. A very impactful statement. Thank you so much.
Thank you.